Well, today is Blue Monday, a day some claim is the most depressing day of the year. A number of experts have debated the science behind the concept, but one thing is certain, some people find the winter months terribly difficult, especially those suffering from seasonal depression. With us this morning is Dr. Robert Levitan of the Center for Addiction and Mental Health. Thanks for coming in on this.
Thank you.
Is it more about the stories because the winter months are tough than it is about the third Monday? How is that science?
Well, we know that mood changes by the season in the population as a whole. So if you look at Canadians as a group, a significant number will feel much worse in the winter than they do in the spring and summertime. And we know that that's due to a lack of light as opposed to changes in temperature. And the typical symptoms would be sleeping a lot, eating a lot, very low energy, poor concentration and attention. And this is something that happens to different levels of severity in the population. So some people are quite severely depressed, others more mildly so.
And are there other contributing factors in addition to a lack of light? Like, you know, you said not necessarily the temperature, but maybe, you know, the economy, or maybe, you know, it's how many weeks past Christmas bills and people haven't been able to get on top of that.
Right. So the idea of Blue Monday or Black Monday, if you will, was designed to take into consideration all those other factors that you mentioned. You know, new ideas for the new year that have already fallen.
Those resolutions
out the window.
Yeah.
And there is a reality that the holidays can be quite difficult, and of course financial planning and stress can be difficult as well. And I think a lot of people slow down work-wise in December, and then it sort of catches up to them again in January as well. So there are these confluence of factors that can affect any one individual. And that's sort of separate, though, from seasonal affective disorder, which is more a true disorder that you know, needs to be treated, certainly in people who have severe symptoms.
So let me ask you this, because it's more, it can be more of a talking point as well for people, you know, to kind of make some changes or be aware that they may be a little lower in mood. And what are the kinds of things that everybody could or should do to try to pick things up?
Right. Well, the first thing I'm always asked is, what if I go outside and get more light that way? And certainly if you can do that, if you can spend more time outside and exercise, it's great. But in reality, if you think about it, there's not very many high-quality days in terms of blue skies, and it's not particularly practical to do that. So for people with any kind of disability associated with their depression, we use light therapy. And we have patients sit in front of a light unit that is ultraviolet filtered. It's very bright, commercially available, many different suppliers, and a half an hour of light in the morning can do a lot of good for patients. It regulates their mood, their sleep, their eating patterns, etc. So it's probably the simplest thing to do for most people.
And then exercise. Exercise
can be helpful once you are starting to get better. I find that it's not practical when people are in their state
to say get up off the couch and go, because they don't want to do it, right?
It's not so easy to do. But once you start getting better, I think exercise can add to protection from further mood problems. But it's not really a treatment.
Okay, thank you very much.
Thank you very much.
Have a good Monday.
Thank you.
Here's to having a good Monday. Appreciate your time.